I'm Cynthia Moorhead, and I will be presenting patient access to electronic health records. At the end of the presentation, the viewer should be able to define the electronic health record and personal health record, discuss proponents for patients accessing EHRs, explain evidence-based research and best practices to support patients' access to EHRs, and identify special considerations with patients' access to electronic health records. The purpose of this presentation is to provide nurses with evidence-based research to support the discussion of patients having access to their electronic health records, including clinical notes. Based on best practice, by allowing patients to have access to their electronic health record, it can create trust and a positive impact on patient-provider relationship and a potential for patients to improve self-care, health, and patient-centered outcomes. Nelson and Staggers defines electronic health record as a longitudinal electronic record of patient health information produced by encounters in one or more care settings. The EHR is used interchangeably with electronic medical record. There's no universal definition to personal health record. However, the Medical Library Association and the Library of Medicine defined PHR as a private, secure application where an individual may access, manage, and share their health information. The PHR may or may not include information from the electronic health record, and it is not synonymous with the EHR. Let's discuss the proponents for supporting patients accessing their electronic health records and the evidence-based benefits for patients. One of the benefits of patients accessing EHRs is increased empowerment. In a qualitative study, Davidge et al. Interviewed 30 primary care staff to examine their views of patients accessing health records and found that patients' access to entries encourages patients to take more responsibility for their healthcare needs. And over 2/3 of participants identified opportunities for greater patients' autonomy, and this was seen as mutually beneficial to patients. In another study, a systemic review of literature of the benefits of patients' access to EHRs, Tapuria et al. Identified that patient access to their EHRs is the first step towards greater patient empowerment and shared decision-making. The literature also revealed an improvement in self-care and self-management as another benefit for patients. Tapuria et al. Found that there was an increase to patient adherence to medication schedules and advice provided by clinical staff once the patients had access to their EHRs. The authors also just suggest patients with an interest in their own EHRs are generally interested in pursuing greater self-care, self-management of their conditions. And another benefit is an increase in patient engagement and participation. In a qualitative study, Zanaboni et al. Found that online access to EHRs make it easier for most people to understand their health status, enabling patients to actively participate in consultation. An example of access to EHR and clinical notes comes from Norway, where all citizens and residents have the right to read their health records. All documents are available in digital format, including psychiatric reports, and are made available to the patient after they are approved by health professionals, unless the health professional decides to deny access. In a personal interview with a citizen of Norway, Tenjidal states logging on is very safe and has security steps. Here is the home page of the patient record. You can see everyone who looks at the record. Patients have the right to have complicated terminology explained as well. And when asked what their feelings were about being able to access clinical notes, Tenjidal states that she feels comfortable seeing the notes as she feels like she is in control of her health. And now we'll discuss the impact of supporting patients accessing their EHRs and the evidence-based benefits for providers. The literature showed access to EHRs by patients increased transparency for patients and trust towards health professionals. In the qualitative study, Zanaboni et al. Found that an increased transparency can result in a better dialogue with the patient. One interviewee noted their experience that many patients become much more trustful towards them because they aren't writing anything behind their backs. Health professionals talk their patients through the content of the record before they leave the consultation to avoid possible misunderstandings, which can result in improving patients' health data literacy. In another qualitative study, Davidge et al. Found that health professionals considered patients' ability to access their EHR could be used to demonstrate clinician accountability, and that increased transparency offered patients reassurance that nothing's being kept from them. Transparency of the patient's records thus changes the dynamic of the patient-provider relationship, with data becoming a shared collaborative artifact between them. Tapuria et al. State that patient access to their EHRs could help develop the patient-provider relationship and help patients identify any inaccuracies with their EHR, improving poor data quality that accounts for several medical errors, and enhanced patient-provider communication. Lastly, literature shows a common agreement that the quality of clinical notes has improved. Interviewees mentioned that they've become more careful about what they write and how they write it, and that the awareness that the patient can read the notes might result in using a more objective and understandable language. Some clinicians recognize that adaptations to documentation could transform the quality of notes with clearer plans for patients to follow and ultimately improve patient health literacy and engagement. Let's discuss some of the special considerations with patients accessing their EHRs. A special consideration relates to privacy and security. Although the new developments in health information technology have changed the way healthcare is delivered, participants still have concerns that the use of a patient portal to access EHR would potentially compromise personal health information. Sekman discusses the continued privacy and confidentiality concerns for both healthcare professionals and consumers. And with the expansion of EHRs as an incentive to automate and share health information, clinicians may find government and regulatory requirements for controlled access to patient information too restrictive or an invasion of privacy. Another special consideration is the difference in laws that are applicable in various states in the United States in promoting EHR access to minors. While the minor might welcome such access, it could raise concerns among parents regarding the level of details visible to the patients. Also, there's concerns that are raised about vulnerable patients at greater risk of being coerced into sharing their record online, and perceive this as an issue that is more difficult to control outside the safety of a physical consultation. Lastly, the literature revealed considerations with patients with mental health issues. There are concerns about possible harm triggered by reading the notes, and that transparency may cause unnecessary worry, confusion, or distress among patients who read their mental health progress notes without guidance from clinicians. However, some interviewees mentioned that access to EHRs can contribute to removing stigma around mental health problems and create more openness about mental health in society. And in a mixed methods evaluation of a pilot program that provided behavioral health outpatients with online access to therapist visit notes to assess whether these notes would offend patients and damage the therapeutic relationship, O'Neill et al. Found that 1/3 of patients reported trusting their therapists more and noted patients feeling validated, understood, and improved the therapeutic relationships. The vast majority found notes very extremely easy to understand.